Okay, let's jump right in. Childhood incontinence. It's one of those really sensitive topics that brings a worried parent to your pharmacy counter, right? It's way more common than people think, it's treatable, and honestly, your role in counseling is just absolutely crucial. So in this explainer, we're going to break down everything you need to know to confidently guide these families.
So picture this, a parent comes up to you, kind of lowers their voice and asks for advice about their child's bedwetting. We've all been there. Before you can say a word, you need a game plan. What are the must-ask questions? What little bits of info are going to steer your recommendation? Let's build that mental checklist right now.
We're going to tackle this just like it's a real consultation. First, we'll get a solid handle on the problem itself. Then, we'll talk about all the non-drug advice you should be giving out first. After that, we'll get into the key medications, and finally, we'll wrap it all up with the most important counseling points that really help families succeed.
All right, let's start with the absolute basics. You've got to get the terminology right from the get-go. Is it happening during the day, or is it only at night? The answer to that one simple question, well, it changes pretty much everything.
So, first up, let's get our terms straight. Daytime incontinence is exactly what it sounds like, accidents while the child is awake. And uresis, on the other hand, is the official term for what we all call bedwetting. And here's a key detail for both. We don't really consider it a clinical issue until a child is at least 5. That's a huge point for reassuring parents of younger kids who are just taking a little longer to get the hang of it.
And this right here is exactly why your advice matters so much. Just look at these numbers for daytime issues alone. It affects 1 in 10 kids between 4 and 6 years old. It is super common, but you know it causes a ton of stress for the child and the whole family. Your ability to just normalize it and give clear, calm advice, it's a game changer.
Okay, so you understand what's going on. Where do you start? Well, in almost every single case, the answer is not with a prescription. It's with non-drug therapies. Before anyone even thinks about medication, there's so much you can do. This is where your skills as a healthcare professional really come into play.
When that parent is talking to you, you're basically a detective, listening for clues. For instance, if they say it's a huge amount of urine right at the beginning of the night, that screams classic bedwetting. But if it's happening a few times a night, and the amount is different each time, your brain should immediately be thinking, overactive bladder. And you have got to ask about constipation. It's a huge, often missed piece of the puzzle that has to be treated first.
This all boils down to 4 simple first-line steps you can give to any parent. Number 1, and this is the most important, reassure them. And please, strongly advise against any kind of punishment. It just doesn't work and it makes the child feel awful. The other steps are really practical lifestyle tweaks. And that uresis alarm, it's an incredibly effective tool for the right family.
Now, it's really easy to think the alarm is just there to wake the kid up, but it's so much smarter than that. It's actually a form of conditioning therapy. It's training the child's brain to recognize the feeling of a full bladder and wake up on its own. And that's why, even though medication might work faster, the alarm often provides a much more permanent fix. Once a kid is dry with an alarm, they are way less likely to relapse. That is a huge counseling point.
Okay, now let's talk about the moment you're handed a prescription. We're going to focus on the 2 main types of medication you'll see, what they do, and most importantly, what you absolutely have to tell the caregiver when you dispense them.
The first one you're probably going to see is desmopressin. You know it as DDAVP. A really simple way to explain this to parents is that it's basically a copy of a natural hormone that tells the kidneys to take a break and make less urine while they're sleeping. It directly tackles that problem of too much pee being produced at night.
And the thing is, it really works. About 3 out of 4 kids who take it see a significant drop in wet nights. It's effective, and that's why it's a go-to choice, especially when a family needs a quick fix for something like a sleepover.
Okay, listen up. If you only remember one single thing about desmopressin, make it this: the risk of hyponatremia. That means dangerously low sodium levels because the body is holding on to too much water. It's rare, but it can lead to seizures and it can be fatal. Your counseling here is a life-saving intervention. You have to stress this. Strictly limit fluids for 1 hour before the dose and for 8 hours after. And if the child gets sick, especially with vomiting or diarrhea, they must stop taking it, period.
So the other big category of drugs you'll see are the anticholinergics, like oxybutynin. These guys work in a completely different way. Instead of telling the kidneys to slow down, they work directly on the bladder muscle, helping it relax. This reduces those sudden contractions and the feeling of "I gotta go now" that you see with an overactive bladder.
So what we have here are 2 totally different tools for 2 different problems. Desmopressin turns down the faucet, reducing urine volume. Anticholinergics calm down a twitchy bladder. And that means your counseling points have to be just as different. With desmopressin, you're laser-focused on that fluid restriction. With anticholinergics, you're preparing the family for the classic side effects: dry mouth, constipation, maybe some flushing. Helping them manage those is going to be key for sticking with the treatment.
All right, let's bring this all home. Let's pull everything together into some solid counseling advice. Because remember, your job isn't just to stick a label on a bottle. It's to set that whole family up for success by managing their expectations and really reinforcing their role in the treatment plan.
So as you're talking to a family, you should be listening for the things that predict success. And you know what the biggest one is? It's a motivated child backed up by a supportive family. If you hear that the kid really wants to be dry and the parents are all in and ready to be consistent, their chance of success just skyrocketed.
Now, on the flip side, these are the red flags, and please listen to this one closely. The number one reason treatment fails isn't something to do with the child. It's an annoyed or intolerant parent. If you pick up on frustration or anger from the caregiver, that is your cue to gently step in and spend extra time counseling them on patience, support, and just how much this is affecting their child.
Here's a brilliant way to help parents understand their options. You can frame it as short-term gain versus long-term solution. Desmopressin, that's your short-term win. It works right away, it's perfect for summer camp. But the alarm, that's the long-term investment. It takes weeks, yeah, but it's actually retraining the body, which means there's a much lower chance the problem will come back later.
And really, this is what it all comes down to. This is the crucial takeaway. Whether you're talking about an alarm, a medication, or just simple habit changes, none of it, and I mean none of it, will work without a supportive family. Honestly, the most powerful thing you might do is explain to a parent that their patience and positive attitude are more powerful than any pill you can give them.
And that's really the thought I want to leave you with. Your expertise goes so far beyond what's printed on the drug leaflet. By truly understanding the condition, by asking the right questions, and by counseling the entire family, you become an absolutely central part of that child's support system. So the real question is, how can you, standing right there at your pharmacy counter, truly empower these families for lasting success?